We're talking with Dr. Richard Falivena from Saratoga Hospital. Dr. Falivena, are you on the air there? Are you there?
Yes, hi, how are you?
Very good. Thank you for joining us today. I know you're very busy, but we appreciate you being a part of this. Lots of questions, and one of them that came into the studio just recently was, if I was quarantined, if I came down with it, how long would I be infectious? What's the standard time?
Great question, Walt. We believe that a 14-day quarantine is adequate. I do have to say, though, Walt, all quarantine is managed by the local and the state Department of Health. So at the hospital, we're treating sick patients, whereas the Department of Health is trying to quarantine people in the community to prevent spread. But 14 days is the average time.
Okay. Well, that's certainly helpful. I know you look to leaders like Dr. Anthony Fauci on a national basis, who was talking about, will we have enough equipment, as in respirators and other equipment available, should it become necessary to do that. What's going on at Saratoga Hospital to help prepare for an increase in patients, which we know is probably inevitable?
Sure, Walt. Before I answer that, though, I do want to comment on your citing Dr. Fauci. It's so important in times like this that people get information from the most reliable source. So Dr. Fauci, the CDC and their website, cdc.gov, the Saratoga Hospital website, certainly the New York State Department of Health website, that's a great place for information. There's a lot of information out today which may not be so well vetted, so I really want to encourage all your listeners to go to someone like a Dr. Fauci. And then, in terms of our response, I want you to understand that all of the Capital District hospitals have come together. We each have our own, we call it incident command, which is how a hospital manages their disaster or emergency planning. And on top of that, the 9 regional hospitals meet every morning, 7 days a week, on a conference call. We're sharing information. We're sharing best practices. We are debriefing every day and talking about our human resources issues, supply management, capacity, process and procedures. You may know that recently we've agreed upon some visitor restrictions throughout the entire capital region. Anything that has to do with patient care and community care, we feel the hospitals need to have a unified voice and continue to give out a consistent message to the public, Walt.
In today's day and age of information that's just everywhere throughout the internet, that's really sound advice. This is something we really need to focus on. That's where we get our information, and that's what we're striving for here at the radio station, is to try and find those sources that are credible and are updated and giving people the best practices. Now, without getting people to overcrowd the hospital, if you should suddenly feel the potential symptoms of coronavirus, what's your first thought? Call or stay hunkered down?
Call first is our mantra. So if people, even if they're well and they just have concerns, it's so much more important that we have a telephone interaction. We're actually working, Walt, on visits by electronic media, sort of a Skype visit where the doctors and the patients can interact, both audio and visual, but that's a couple days off still. But call first. So if you have fever, cough, shortness of breath, if you've been in contact with somebody who's been tested positive for COVID, or if you have any other concerns whatsoever, call ahead. And your provider will be able to give you the best advice as to what to do.
For us individually in Saratoga Springs, I'm sure that you've got the best way to avoid it, and certainly diet is something to think about, but also adequate rest, correct?
Absolutely. It goes back to very basic. Keep your hands clean. Keep your hands away from your face. Eat well. Rest. And the social distancing that we hear about Staying home when you're sick, not going out to public places. I think right before we talked about how the city center has suspended their events, and that's what we need to do a little bit more of. You know, Walt, we cannot prevent people from getting the virus. People will get the virus. What we're trying to do is mitigate. We're trying to get the rate at which people get the virus to slow down. As it slows down, we have the capacity to manage it. Everyone's nervous because they see something like what happened in Wuhan or what happened in Italy. And there they had, for a variety of reasons, did not start the type of public health, social distancing, hygiene, etc. early enough, and the infection spread too rapidly and their system was overwhelmed. So again, listen, go on the CDC website, listen to what the State Department of Health is saying. Wash your hands. Stay home if you're sick. Avoid unnecessary contact with large groups. And especially if you have family, friends who are elderly, who have serious medical conditions, check in on them often, see how they're feeling. Again, we're learning now that it is possible that healthy people have minimal to no symptoms, but they may be able to spread the virus. So that's why the social distancing is so important.
Makes a lot of sense. We're talking with Dr. Richard Falivena from Saratoga Hospital. One last question, Doctor. As a component of all this, fear and anxiety, we see it as we walk into a store and see shelves empty. I know this is a part of it. As we look at numbers, we see, oh, there's 2 in Saratoga County. Oh, now there's 4. Those numbers will go up, but should not cause anxiety. Like any other flu, those numbers will increase, expected. Don't, get paranoid about it, but do your best practices. And I know that fear and anxiety is a part of the issue that we're trying to deal with here with this special report. Any advice that you can give us about that?
Well, again, I go back to the fact that rumors and speculation are harmful. And if everybody arms themselves with the facts are we have managed pandemics before. We have had, if you recall, the swine flu, the H1N1. We have had pandemics throughout our history. It's not to minimize this, but it's to say to people, use common sense. Listen to Dr. Fauci, listen to the CDC, use the simple public health measures of hand washing, social distancing, isolating yourself if you're sick, isolating yourself if you've been exposed, and this is something we're going to get through. I really believe the message to the public today is that New York State and the capital region is well ahead of the curve in terms of managing this outbreak. And we just need people to remember what our famous President Roosevelt said, nothing to fear but fear itself.
Right. Well, we thank you so much for your expertise. Knowing experts like yourself are on the case makes us all feel a little bit better, sleep a little bit easier. Good luck with the days ahead. We know you're going to be very busy, you and your team at the Saratoga Hospital. We appreciate your time here today, and we will stay in touch.
Thank you, Walter. And I'm going to say, before I cut off the phone, I cannot be more proud of the people who work here at Saratoga Hospital. They are a dedicated team. They show up every day trying to do their best for the community. We are so fortunate to have that group of professionals here. Thanks again, Walter.
Thank you very much.